you up, brother. I think I really hurt my hand.
Me too. Let's go get a Diet Dr. Pepper. It'll fix it right up.
Hits the spot.
Delicious. Have you felt sick lately? I feel nauseous all the time and I have no appetite. But when I do get to eat something, I just throw it up.
Well, you have been looking funny recently. Your skin looks funky, like it's yellow or something.
Well, you should see my body waste. The color of that is frightening too.
Maybe you should go get that checked out.
You're probably right.
Call the doc and set something up. Or just show up, maybe?
Yeah.
Symptoms you may expect to see is vomiting, nausea, an enlarged liver, spleen, or jaundice in the skin or eyes. Some chronic symptoms may include cirrhosis, which is the hardening of the liver cell cancer, as well as chronic hepatitis.
Hello, what brings you in today?
Hey, I haven't been feeling very good recently. My brother said I looked a little yellow, and I've been feeling nauseous all the time. I haven't been able to eat. Whenever I try to eat, I usually throw it up.
Okay, interesting. Would you mind if I ran a couple blood tests?
I don't really like needles that much. Is there any other way we could do that?
For some viruses, like for example hepatitis B, the only way to know if you have contracted the virus is through blood testing. Would you be okay with it?
I guess if it's the only way, maybe. I need to drink some Diet Dr. Pepper first, though.
The best test is a blood test known as the ELISA test. The test checks for 3 HPV screening stereo marks: the surface antigen HBsAg, the E antigen HBeAg, or the core antigen HBcAg. Detecting damage can be done by liver ultrasounds or biopsies.
So your results are back in and we found some interesting results.
What's that?
You're currently in this acute stages of having hepatitis B.
Acute stages of hepatitis B. What's acute mean?
Sometimes hepatitis B goes away on its own, and this usually happens within the first 4 to 6 weeks. So until after the 6 weeks, we consider the infection acute. But following the 6 weeks, you are considered a carrier and will be for the rest of your life.
Okay.
Do you have any idea like how you might have gotten this? Only humans are carriers, and it's spread through blood-to-blood exchange. So it can happen when like a child is born, which obviously isn't what happened to you, but it can happen anytime an individual participates in sexual intercourse with an infected individual or comes in contact with an infected person's open wound or shares sharp objects like needles or razors or like nail clippers. Do you have any idea?
Well, the only person I know that has hepatitis B is my brother, but last month we were playing soccer and we both fell and scraped our hands open, and then he helped me up. So that could have been when it maybe got it.
Oh yeah, that is very likely that you could have contracted the disease then.
What really happened when Dr. Anderson and his brother had contact was the hepatitis B virus traveled into Dr. Anderson's blood and the enzyme proteins attached to the receptor cells on the liver protein. The liver usually uses its hepatic globules to filter out the blood, break down harmful substances, and store nutrients. When hepatitis B enters the liver, it infects the healthy liver cells and makes copies of itself. When the immune cells recognize the infection, the liver becomes inflamed and those cells die, leaving scar tissue in the liver and prevent it from working properly.
I'm sorry to inform you, but there is currently no cure for hepatitis B. But if there are signs of liver damage caused by the virus, we can manage the damage with an antiviral medication. We most commonly use entecavir, which is an oral tablet. As of now, your liver function is acting in the normal ranges, so we consider you compensated. So you would only take 0.5 milligram daily until the liver symptoms disappear. But if your liver functions were to start acting out of the normal ranges, we would consider you non-compensated, and then you would take 1 milligram daily. But do you have any questions about that?
Well, where would I get this entecavir medication?
I'll call it into the pharmacy right now, and then you would go pick it up yourself.
Okay, thank you. And you know what they say, everybody loves Mondays. Have a good day.
You too.
Hey, I'm here to pick up a prescription.
Okay.
My name is Rodney Anderson.
Okay.
I think I'm picking up something called like entecavir or something.
Okay, I've got it ready for you.
Okay.
Come along around here and have a seat. All right, here's your prescription. Do you have any questions for the pharmacist today?
Yeah, actually, could you tell me how to take this medication? I don't really know much about it.
Hepatitis B can be cured on its own within 4 to 6 weeks after being infected. After 6 months, there is no cure. Doctors treat hepatitis B with a drug called entecavir. When the virus enters the liver, entecavir inhibits the hepatitis B polymerase and blocks reverse transcriptase activity, reducing DNA synthesis. Hi, I'm Hanna, the pharmacist here. How may I help you today?
Hey, I had some questions about my entecavir. I don't really know how to take it or anything.
Okay, yeah, entecavir is pretty easy. It has to be taken once daily, and there should be no problems. But if there are any, you can come in or call, and your doctors will express your concerns.
Okay, that sounds good.
That's good. Did your doctor tell you about any preventative measures that you can inform those around you?
No, I don't think I know any.
All right, well, these want to be helpful for you because you already have the infection. You should encourage others to get vaccinated. Most individuals get vaccinated as a child or when they're 18 years of age and older and are at risk of contracting hepatitis B. You should get vaccinated.
Man, I learned a lot about hepatitis B today. Well, what a day it's been.